I sort of grew up all over. Of late had gone to Colorado for my college, and then after Colorado went back to my hometown of Lancaster, Pennsylvania to look at my residency after medical school in Temple, Philadelphia. So I went there for my medical school in Philadelphia and then came to Lancaster, Pennsylvania for my residency in family medicine. After that, I owed my time to the Navy. So the Navy said, here's where you're going, Camp Lejeune. I didn't know anything about Camp Lejeune. Came down here 14 years ago. Was supposed to be here for 3 years, but met my wife here and now have 5 children, and have continued to enjoy taking care of not only dependent active duty personnel, but as well as retirees, as well as the population here in Jacksonville that aren't military as well. So I am family medicine, and that means pretty much for me, I used to deliver babies, but don't do that anymore. I take care of 2 weeks up to, I have a couple patients over 100 years old. So I take care of the full gambit. Areas that I have always been interested in, have spent extra time being educated in, include sports medicine, orthopedic type sports medicine, dermatology. I spend a half a day a week just doing dermatology, which includes everything from excisions of moles, excisions of minor cancers, and things like that. I also have a very large spiritual aspect to my practice. Most of my patients know that I'm a Christian, and that comes through and is very important to me in how I take care of and how I deal with some of my patients in that aspect. As a Christian, I believe that the spiritual health of my patients is very important. So even if they're not Christians, I still feel that the spiritual health of individuals drastically impacts their physical health as well. So how we manage everything from depression, anxiety, obesity, diabetes, or high blood pressure can all be impacted on how a patient's looking at their health. And from a perspective as a Christian, many of those things directly have application to where we're coming from spiritually in our spiritual lives. So I definitely have integrated that, and I believe in all the years I've done that, I've never had a patient complain about that or say that they didn't want me discussing that at their physicals or at other times where they're going through difficult issues, either of their physical health or their mental health. Well, I have 5 children, so that is going to keep my time pretty busy as it is. We actually homeschool our own children too, so that also incurs some other work for me as a teacher, as well as not just dad and a physician and a husband. I am also an elder in the church that I attend, so that also takes up quite a bit of time as well. And then otherwise, I like to keep fit. My boys and I both, we all play lacrosse together, and I'm also found my main aerobic source of exercise is ultimate frisbee on Saturdays and Sundays to keep myself hopefully in shape as much as I can. I feel if I'm going to tell my patients to be in shape and do the things they need to keep in shape, that I better be doing them too.